Hi, thanks for joining us today. I am Dr. Erik Sweet, an ophthalmologist with Baptist Eye Surgeons, and we're doing an Ask Me Anything session on eye infections. So we're going to go over some questions that people have submitted here. So the first question is, what are the most common types of eye infections that you see, and what are the most common ways patients get eye infections? So in ophthalmology, we break down eye infections by the type of tissue or the structure of the eye that the infection involves. So the most common type of infection is what's called a conjunctivitis, and this affects the conjunctiva, which is a clear tissue over most of the eye. And the most common infection there is a viral conjunctivitis, also known as pink eye. Probably the next most common infection we see of the eye is called a keratitis, which is an infection of the cornea. Now, the cornea is a clear surface over the very front of the eye through which all light that enters the eye passes through. And that can be a bacterial or a fungal or even a viral infection of that tissue. Another common infection we see of the eye is really kind of around the eye. It can be a cellulitis, which is a skin infection that affects the eyelids or even the tissues surrounding the eye. People can also get infections inside of the eye itself, and those are fortunately less common, but can also be more severe. What are the common ways we get eye infections? So the different infections can be picked up in different ways. So something like a conjunctivitis is usually transmitted from one person to another. And it can be from someone who has a viral infection or has an active pink eye, then it moves to somebody else. There are also some severe forms of conjunctivitis or more severe forms of conjunctivitis that can be from sexually transmitted infections as well. The keratitis or infection of the cornea, those are most commonly seen in contact lens wearers, especially those who sleep in their contact lens or swim in their contact lens. So that's why it's something that needs to be avoided if you wear contact lenses. They're much you common if you don't wear contact lenses. However, they can occur from minor trauma as well. So if you get poked in the eye, it's important to see somebody to make sure that you don't get an infection. And we can do things to prevent infection as well. A cellulitis or skin infection often comes through something like a mosquito bite or minor trauma to the eyelid itself. And sometimes these infections spread actually from your sinuses and into the skin and tissue surrounding the eye. Another kind of common cause of infections would be herpes or shingles virus, and they can pretty much hit any structure of the eye from the front to the inside and the back of the eye. Having eye surgery is a cause of infection. Fortunately, it's very rare to have surgery after eye infection, eye infection after surgery, because we do a lot of things to prevent that. So the next question we had was, how do I know if I have an eye? How do I know if I have an eye infection? What are the most common symptoms that I should look out for? So, and this kind of hits it. An eye infection is generally can be determined by the symptoms that a patient has. So, if you're having redness, pain, blurred vision, a goopy discharge, or even sometimes just a light watery discharge from the eye, light sensitivity, these are all signs that you may have an infection. Really, a diagnosis of an eye infection should be made by an ophthalmologist, because we can look at the eye under a microscope and have a lot of criteria and ways to determine if an infection is going on in the eye. All these symptoms that I've discussed can be caused by many different problems that people can have with their eyes. In fact, I have a lot of people who come in and think they have an eye infection when it's really some sort of inflammation or irritation, but not actually an infection. It's important, if you have signs, any of these symptoms, that you come and find an ophthalmologist to take a look, because we can determine if it's an eye infection that needs to be treated or something else, sometimes something worse or something benign or something that needs quicker treatment in order to prevent worsening. Someone asks, how are eye infections treated, and is there anything I can do at home? So eye infections, again, depending on the infection, can be treated in many different ways. Some eye infections, for instance, viral infections, don't need any treatment for the infection. We just do things to keep our patients comfortable. Other infections, for instance, keratitis, often needs antibiotic or antimicrobial eye drops. Severe infections can need constant treatment, including intravenous or oral antibiotics, rarely admission to the hospital, but also frequent monitoring to evaluate for worsening and hopefully improvement. But the treatment really depends on what's going on inside the eye or around the eye. Because of that, treating at home is generally not advised. In fact, it can be harmful because it can delay a diagnosis. If somebody has dry eye or inflammation of the eye, and they're not, especially if they're not having a lot of pain or reduction in vision, it's okay to do some artificial tears at home. Some warm cloths on the eyes can be helpful as well for inflammation, or on the eyelids, I should say. But anything that's not resolving quickly, anything that worsens or persists, should be evaluated again by an ophthalmologist. Even if a primary care doctor or emergency room is treating a supposed eye infection, if things are not getting better, it's very important to come and see one of us, because we can, like I said, get you under a microscope and evaluate and target the treatment to exactly what's going on in the eye. So don't delay, try avoid treating at home, and come get evaluated. Somebody asks, are there things that can make an eye infection worse or delay the healing process? And absolutely, really, what's going to make an eye infection the worst is a delayed proper diagnosis. So the sooner the right diagnosis can be made, the better the eyes will do. Now, there are some infections that will resolve on their own and don't need treatment, but it can be difficult to distinguish a minor or benign infection with something more severe. So really, the worst thing for someone's eyes is that the proper diagnosis is made late. And sometimes that can be, days can make a difference. Sometimes it's longer than that until it really matters. The other thing is not following the proper prescribed treatment can be harmful. So if an eye doctor tells you to use drops, a certain frequency, a certain amount of time, and avoid doing things, it's important to listen to that because there's reasons. And if the treatment's not being followed, then the eyes can be slower to recover, or in some circumstances have a worse outcome in reduction in vision. Somebody else asks, are there any eye infections that can cause loss of sight or complete blindness? The good news is, well, yes, they can, but the good news is it's very rare. Usually, we're talking people who are sick in the hospital, immune compromised. It would be generally the reason somebody would have such a severe infection. But people who sleep in their contacts or swim in their contacts can get severe eye infections as well, and can lead to loss of vision. In rare circumstances, anybody who has surgery on the eye can get an infection that leads to loss of vision or severe decrease in their vision as well. The take home there is, again, don't sleep in contacts, don't swim in your contacts, and that's about it that you need to worry about in terms of prevention of real severe infections. A person asks, can a person have a chronic eye infection? So chronic means that it's ongoing for long periods of time, sometimes despite treatment. And absolutely, somebody can have a chronic eye infection. This is normally seen if somebody is not properly treated, does not complete the course of treatment. We kind of say lost to follow-up. Someone who's treated for a couple days, maybe things start to get better, and then they decide not to come back in for further evaluation. That's much more common to cause a chronic or a persistent eye infection. But some severe infections can persist despite treatment. And it's important to, again, have the proper evaluation, because an ophthalmologist will know when the current treatment is not working and can step up treatment to prevent and control the infection. There's also some underlying conditions that can lead to recurrent infections, more recurrent than chronic. So if those underlying treatments aren't, or those underlying causes aren't addressed, then people may be prone to have either recurrence of eye infections or chronic eye infections. An example of this would be people can have a obstructed tear duct, and that can lead to an infection. And once it's treated, symptoms may go away. But if the tear duct stays obstructed or blocked and that's not treated, then they're prone to have more infections down the road. So somebody asks, are some people more susceptible to infections than others? And we're back to the contact lens thing again. People who sleep in contact lenses or even just wear contact lenses are a slightly higher risk. But sleeping in contact lenses, swimming in contact lenses puts you at a much higher risk. Children are at a higher risk for eye infections, really not necessarily severe eye infections, but your typical pink eye. And that's because kids, if you have kids, you know that they touch things that maybe adults wouldn't touch. They put their hands to their face. They don't wash their hands as frequently, and often are in much more contact with other children than adults are. So also, having previous surgery puts you at a higher risk of an eye infection in a recent surgery, which is why it's important. And anybody who has surgery with us understands that if there's any significant symptoms, problems with the eye, that you need to be evaluated, because we need to rule out an infection, which is rare but can be serious. How can I prevent eye infections? Pink eye is constantly going around my daughter's school, and I want to do everything I can to help her from getting it. It's a great question. Pink eye can put your child out of school for some time, because we don't like to send kids to school with active infections. The most important thing for kids in preventing infection would be hand washing. So if you teach your kids to wash their hands frequently, when they use the restroom, when they come out of the restroom, and even aside from that, frequent hand washing will reduce the incidence of getting a viral conjunctivitis or pink eye. In addition, touching the face is a risk for pink eye. So usually pink eye is transmitted by contact. So it gets on somebody's hands and then they touch their face, and it spreads to their respiratory system or their eyes. So that's why washing hands is important, and it's also why avoiding face touching is important. Sharing personal, especially hygiene products with other children can put someone at risk for getting a viral infection. Hairbrushes, certainly, toothbrushes, washcloths, that kind of thing, can be objects that spread the virus from one individual to the other. Pink eye often hits households too, because one person in the household gets it, and then it's easy to transmit to somebody else. But in terms of avoiding it from school, it's important to wash hands, avoid unnecessary sharing of personal effects, and avoid touching the face. So lastly, somebody says, I'm constantly worried that my eye makeup will give me an infection. How common is this, and how can I prevent it? Fortunately, while makeup can lead to an eye infection, it's relatively uncommon. Most commonly, you would see an infection from makeup from old makeup or from makeup brushes. So if your makeup's accumulating dust on it, that's a sign that maybe it's time to replace it. Same with the makeup brushes. If you find that you're not using makeup for several months, 4, 5, 6 months at a time, it might be time to replace that as well. What happens is when you use a makeup brush or makeup, you transfer bacteria from your skin, from your hands, from your environment into the makeup, where it can then grow, reproduce, and proliferate. And then when you go to use it again, there can be a higher burden of bacteria that can lead to infections of the eye. In general, if you're using fresh, not old, dirty makeup, most people shouldn't have much of a problem from getting infections from wearing makeup. I learned long ago not to tell women not to wear makeup, that can cause some trouble. So continue wearing your makeup, but just practice safe and good hygiene with that. So I think that's all the questions we have today about eye infections. Thank you for joining us for this Ask Me Anything session. Continue to follow us on Facebook and social media, and if there's a topic that you would be interested in hearing about in regards to the eyes, send us a message and we'll look into putting on a session for that. As always, if you have any problems, come and find us at Baptist Eye Surgeons, and we can evaluate whatever concerns or questions you have with your eyes. Thanks. Have a blessed day.